Hello, I'm Julie Vos, Chief of Hematology Oncology at the University of Nebraska Medical Center in Omaha, Nebraska. So at the Nebraska Medical Center, we see approximately 1,500 patients per year that have different types of hematologic malignancies. That would include lymphoma, multiple myeloma, leukemias. And of those patients, probably about a third of those are multiple myeloma patients, so we see quite a large number of patients. For our inpatient facilities, we have 24 transplant beds that include also patients that get high-dose chemotherapy. We also have 10 additional beds of what are called cooperative care beds, and those are where a patient and family can stay together and receive all of their care that they need for their hematologic malignancy and stem cell transplant. We also have a 24/7 outpatient treatment center where patients can be seen in comfort 24 hours a day, 7 days a week to get the type of specific oncology care that they need with their oncology nurses, also with the physicians to see them 24 hours a day, 7 days a week. So very high level of service that we see for our patients. In about 4 years, hopefully, we'll have a new cancer center where we'll be able to increase those numbers of beds, be able to treat even more patients comfortably in both the outpatient and inpatient arena, and be able to hopefully help more patients. Our program is unique in that we have physicians that specialize just in specific types of malignancies. So in this case, we have 2 physicians that specialize in multiple myeloma, and we see patients from the time of diagnosis through any type of treatment they would need and through transplantation, so disease-based physicians. In addition, we also have disease-based nurse case managers who help us with those patients, and so they're also specialized in the specific area of multiple myeloma as well, help the patients through their treatment, and then we do have a specialized nurse case manager also for the stem cell transplants for patients with multiple myeloma. So they're very well versed in that specific disease, what the patients need, and their specific types of needs during that type of procedure and treatment.
My name is Meg Ersick. I'm a general oncology nurse case manager at the Nebraska Medical Center. My role has been working with the physicians that care for multiple myeloma patients during that time when, if they're not having a bone marrow transplant, either before or after, or if they're not going to have a bone marrow transplant, then I would follow them the whole time. So I'm kind of their point person, their private nurse, if you will. So, you know, we have a direct line to our phone, so it's not a nurse triage where it's a number of different nurses. They have a specific nurse they call. If we don't know the answer to their question, we do a lot of triage of answering questions. If they need to come in, we kind of start that, you know, if they're ill and we initiate that, well, you think we need to come in, or maybe some symptom management. If it's a question we need to ask the physician, then we really literally track them down. Hunt them down is a better word, but track them down, and so we can get the questions to back to the patients right away.
A lot of our patients come from out of town, and so we're very familiar with working and helping patients that come from long distances and need extra support during their care here. So we have social workers that help them through any type of social needs that they may have, financial needs. We also have actually a concierge that helps them with any non-medical needs, if they need housing or if they need transportation, or if they just need to know where the closest church is. We have someone that will help them with all those types of special needs that they may have to feel closer to home. At
the Village Point Cancer Center, which is really close to a mall, so that's patients like that, but there is this Life Renewal Center, and they offer yoga classes. They'll have the Look Good, Feel Better program out there, which is sponsored by the American Cancer Society at both of our campuses, but they have art therapy, like art projects for patients to come and do occasionally, wig fitting, it's a little sort of gift shop, but with a lot of resources, books, and then some just gift shop things, but also some kind of patient-specific, you know, books and things that they might want to look through. We also have specific tumor boards for different types of malignancies. So in this case, we would have a tumor board in case conference where we go over patients that have multiple myeloma, be able to make a plan as far as overall team management and plan, and be able to set that forward for the patient so they can get the optimum care. Obviously, a very important part of oncology is clinical trials and trying to evaluate new treatments for patients. And as part of this, we are able to offer the latest treatments for patients, new treatments in clinical trials that are not yet available through the FDA. So oftentimes we can get treatments that are available for patients years before they're released to the general public.